Good day, fellow learners. This is your mentor, your fact check buddy Ray Gapuz, joining you from the second floor of the RA Gapuz building here at the United Nations Avenue here in Manila, Philippines. So, before we start our case number 49 discussion, let me first share with you that the topic that we're going to talk about today would be about cleft palate and speech rehabilitation. But before that, please join me in this mission. Our goal is to provide free NCLEX RN application review to 500 nurses. And to help us achieve this, just do this simple trick. Watch and finish the ads in our videos and share this if you share this video to at least 10 of your friends, we'll pray for your success. Thank you very much for doing that in advance. So before anything else, let me congratulate a fellow Tomasian nurse from the University of Santo Tomas who passed the New York Board of Nursing Next Generation NCLEX RN. Congratulations, Miss Rachel Joy Ibanez Castillo. And this is her success recipe. Let's learn from her. Proverbs 16 verses 3, commit your works to the Lord and your plans will be established. First, I want to thank the Lord for being with me since day one of my review until the day I got the result of my exam. I started my comprehensive review last March 2025, and for 3 months, I patiently attended my night classes after having my 8 to 5 work at the Rural Health Unit. So, she is an RHU nurse, which simply means she's not exposed to high level or serious acuity of patients. Mostly patients in the RHU unit are those who are just being monitored for their wellness issues and for vaccines. And she actually got the night or the evening classes, which simply means that's a 2.5 hours a day class. So I attended every class in spite of the overwhelming task during the day because I don't want to miss a single session or lesson or tip. I was juggling a lot of responsibilities, but with God's guidance, I succeeded. I'm also thankful to Dr. Ray, thank you, and all the mentors, especially Sir Jimmy, for sharing your knowledge and tips, and all the staff for being accommodating to all my queries. The functional concepts, TOP, that's our simulation software, and the QUICKFIX are really super helpful. And you have a prolonged word there, super. That simply means it was really a great help. Lastly, I want to thank my family for believing in me and being my motivation. That's Rachel Joy Ibanez Castillo from the University of Santo Tomas. Okay, so those who have a copy of my book, this is actually NCLEX 311. Here are some feedbacks, parang actual, parang reflection po talaga, sir, of the QUICKFIX YouTube and 311 yung questions that I got. So happy I got through the exam successfully. Thank you po, sir, ng marami. Parang actual. And then Chin says also came out. I was like, Sir Ray, know what topics would come out? I'm glad I'm a Ray Gapuz baby. So she says, patok. And of course, Vic is saying, sincerely speaking, if it were not for NCLEX 211, I would not have passed. I went through in the last 4 days to the exam. That book is amazing. Keep up the good thing of helping us nurses. Amazing. So thank you very much. Grab a copy now. And of course, somebody says the NCLEX 311 po the best. Halos same na same po siya sa pagkakakonstruct sa mga na-encounter ko pong mga standalone questions. What she's saying, the book is legit because the way how the questions are constructed, it's like the actual test. So if you would want to join our QUICKFIX focus, it's going to be a 3-day session with me, and you'll get the copy, the most coveted copy of NCLEX 311 plus 24 hours of high intensity review with Ray Gapuz. Okay? So let's talk about case number 49, cleft palate and speech rehabilitation. So when we speak of cleft palate, it is something that develops in utero when the tissues of the mouth and the palate fail to fuse during early fetal development. That's approximately during the 6th to the 10th weeks of pregnancy. So this condition is congenital. What could have potentially caused it? Well, there are several factors that increases one's risk, and the most common of which could be genetic factors. So there could be genetic predisposition, or it could be related to maternal smoking, alcohol use, or certain medications. So you have the sad habits again, meaning smoking, S, smoking, A, alcoholism, D, drugs. So if the mom is engaged in any of those three, there's a greater risk for the baby to have cleft palate. And of course, folate deficiency. Now, a common source of folate during pregnancy is the intake of green leafy vegetables. So you need approximately 300 to 400 micrograms of green leafy vegetables. Now, if you're taking the folic acid supplements, you have to make sure, and this is a functional concept I'd like you to remember if you're taking your test, that you avoid taking your folic acid supplement with tea, because your tea decreases the absorption of folic acid. And then obesity also increases the risk, diabetes, and advanced maternal age. So all of these would interact to potentially affect the development of the soft palate, the hard palate, or both, and this could potentially occur with or without cleft lip. So eventually that results to feeding difficulties because of the presence of the cleft palate that would lead to the inability to create suction. So therefore, it can potentially lead to nasal regurgitation that can lead to ear infection. So otitis media is a potential complication, hearing loss, and speech difficulties. So in other words, a child with cleft palate could face several challenges like poor nutrition, frequent ear infection, or otitis media that could potentially lead to hearing impairment, speech and language delays, and of course, dental issues. So what is the best intervention for a child with cleft palate? Early multidisciplinary care is essential. That means the child should undergo surgery, palatoplasty, and lip repair if there's cleft lip. And these are typically done between 6 to 18 months of age. So the earlier, the better. And then that's followed by supportive interventions that includes feeding assistance, provision of special nipples, which I'm going to share with you in a while, speech therapy. So you have to refer the parents to the speech therapist. And since the client is at risk for recurrent otitis media, they need audiology tests frequently. And then, of course, dental and orthodontic care and interventions, plus the psychological support they need, because definitely if they get to see themselves different from the other kids, that would definitely impact their self-esteem. Okay, so interventions for cleft palate include, remember, the acrostic cleft. Okay, communication support. So there should be early speech therapy and encourage the client to use clear, slow speech, support language development, and prepare for possible surgery. And then L, latching and feeding assistance. So you need to use special bottles or nipples, the Haberman feeder, which I'm going to show in a little while. Feed the baby in an upright position and burp frequently to prevent aspiration and regurgitation. So frequently burp the baby in between feedings. Then ear and hearing monitoring. Regularly assess the baby for otitis media and hearing loss. Refer for audiology or EENT testing for ear tubes if recurrent infections occur. And then F, family education and support. So the most important aspect of discharge instruction in the care of children with cleft lip or cleft palate should be to teach the parents about how to take care of the surgical site, feeding, surgery schedules, and realistic expectations. In other words, they have to realize that there are certain delays in terms of speech of the child, and then provide psychosocial and emotional support. And lastly, team approach. So refer the client to the multidisciplinary cleft team comprised of the plastic surgeon who will be doing the surgery, speech pathologist for the rehabilitation of the speech of the child, audiologist for the prevention and monitoring of potential ear infections, orthodontist because definitely the cleft palate could affect the growth of the child's teeth. And then, of course, the nurse and the psychologist for the emotional concerns. Now, the referral to the multidisciplinary cleft team will ensure holistic and long-term management. So this is the Haberman feeder, and it has several parts that we need to focus on, like the sleep valve at the tip, okay? And then we have here the markings that indicates the position of the sleep valve in the baby's mouth, which means the longer it is, meaning the raised mark, the greater the flow. So if you want to feed the baby slowly, you have to check on the slit markings, okay? And of course, this is how it looks overall, okay? That's the Haberman feeder for the child post-cleft palate surgery. Take note that the area that is usually inserted into the baby's mouth is made of silicone, okay? So that's really, really soft. So before we proceed to discuss our case for today, let me once again share with you the success story of a 66-year-old second courser. So she's not a generic Bachelor of Science in Nursing graduate, but she took up nursing after her engineering course and taught engineering for a couple of years before eventually venturing into a nursing career. And she passed the next generation NCLEX through our system. So congratulations, Ms. Flor Pangilinan Villarier of Ago Foundation College in Naga City for passing the New York Board of Nursing test last December 2, 2024. So here we go. For our case number 49, we have Maria, 29-year-old pregnant woman, is seen at the prenatal clinic. Let's try to identify the risk factors for cleft lip. If we get to see some based on the patient profile. She admits to smoking half a pack of cigarettes, so there's one. Occasionally drinking alcohol, so 2 of the 3 sad habits. So remember, sad habits: smoking, alcoholism, and use of drugs. She has poorly controlled type 2 diabetes. That's another risk factor. Is not compliant with her folic acid supplements. That's 4. The nurse educates Maria that her baby is at risk for certain congenital anomalies, including cleft palate. 6 months later, her baby undergoes cleft palate repair surgery, and after 24 hours, the nurse is caring for the infant. Let's check on the question related to this case. Okay, so which of the following interventions are appropriate for the nurse to implement after 24 hours post-cleft palate surgery? Now, what is essential after cleft palate surgery is to prevent the potential disturbance of the surgical site, and that would entail applying restraints. Now, the elbow restraints is actually applied on the patient's elbow, and there's the more primitive form of it, there's a tongue depressor or a tongue blade in between, so it prevents the patient or the baby from flexing the elbow. So the elbow restraint, therefore, helps prevent the infant from touching the surgical site. Yes, that is correct. Encourage breastfeeding immediately to promote bonding. Well, the breastfeeding is not done immediately, as it could potentially put pressure on the surgical site. So no. Position the infant supine to reduce aspiration risk. No. After cleft palate surgery, it's either you position the baby side lying or prone to promote the drainage of secretions. Provide pain management as prescribed. Yes, that is needed. Avoid placing hard objects like pacifiers or spoons in the mouth. Yes, you need your Haberman feeder. And of course, offer clear liquids using a cup or syringe if ordered. Yes, the cup or the syringe is a necessary tool to help facilitate feed a child 24 hours post-cleft palate surgery. So therefore, the answers are 1, 4, 5, and 6. And this is how your Logan bow or Logan bar is used after a cleft lip and a cleft palate surgery. So it's applied over the cheeks, and this would decrease tension on the suture line, especially when the baby cries. It can potentially put tension on the suture line, so you need your Logan bar or Logan bow. Okay, so that's our discussion for today, and I would like to invite you to use the world's first simulator that looks like the actual test itself, the next generation NCLEX RN simulator at our second floor laboratory here at the Ray Gapuz building here in the United Nations Avenue, Manila, Philippines. Okay, so this is where we're conducting our NCLEX classes. This is our room 402, and this is where our main hall is, where we conduct our bigger classes, okay? And we pride ourselves for having the most restful restroom of all with diffusers and of course our favorite scents, and we have a mini students lounge near the restrooms, okay? So please, if you want more of these videos, don't forget to subscribe, to like, and to share our videos to your friends if you may want them to be updated with the most common topics that are being asked on the test at this time. So we also have our promo. You have the chance to get a free review from us if you process your NCLEX RN application with iTaps Gapuz. That's free review if you process with iTaps Gapuz. So once again, this is your mentor, your fact check buddy Ray Gapuz, saying thank you for joining me today. Share our video to your friends so you can assist them. And for those who are about to take their test, good luck and God bless you.